Good morning, everyone. Welcome to our first town hall of our Family Empowerment Week at Families Together in New York State. I think everyone knows because you were there yesterday for our main event, but Families Together in New York State, I like to just introduce who we are as an organization. Families Together was started by family members of young people with behavioral health needs. And quickly we learned that our kids don't fit into the silos that the different systems have created for funding and for policy and for regulations and even service providing. We are family run and family governed, meaning that over 2/3 of our board of directors per our bylaws, and most of our staff, including myself, are family members or young people themselves with lived experience raising a child with multiple systems involvement. My son is going to be 30 this month, and he is on the autism spectrum. So I learned to navigate the system from the age of 3. So it's been 27 years of this advocacy kind of work. Many of our parents have their child has involvement in developmental disabilities, mental health, alcohol and substance abuse, or use, special education, juvenile justice, child welfare, often multiple systems. Today, we welcome our Deputy Commissioner from the Office of Persons with Developmental Disabilities, and we have a team of people who have agreed to be ambassadors and ask questions and have a dialogue with the Deputy Commissioner so that we could express the concerns and questions that families and young people who have involvement in OPWDD system could have an opportunity to have a dialogue, to share our policy agenda as an organization, and to let family members know that we're being heard here in Albany and that we're having some influence on shaping policy that affects our families. I'm going to turn it over to Brad Hansen, who's our Director of Public Policy, so that he can talk a little bit about our policy agenda.
Thanks, Paige. You know, when it comes to developmental disabilities, our major focus is making sure that our services are family guided, youth driven, are in the community, are inclusive, and we want services that are available everywhere. You know, in the community, in the schools, and recognizing that developmental disabilities, young people who are living with them, are across systems, and so every system should be able to address those needs. And so we're just very excited to hear more from the commissioner, and really excited to dive into the questions that the parents have that will kind of move into, you know, help talk about these things. So we're really excited for today.
So welcome Deputy Commissioner Abiba Kindo, who is here to answer questions, but also to just share with us a little bit about what's going on at OPWDD these days.
Thank you so much, Brad and Paige, and good morning, everybody. It's an absolute pleasure to be here speaking with all of you. I'm pleased to be able to respond to questions that folks may have, but more importantly, to hear directly from all of you about your concerns. I think that families and individuals know that your feedback and input has always really been valued and used to shape this delivery system. And so I'm excited to have the opportunity to speak with all of you today. It's been a challenging year, or the past year has been extremely challenging for many, and certainly has been challenging for our delivery system. We continue to work to battle the COVID-19 pandemic, working with the Department of Health and our care coordinators on educating individuals and families, and certainly providing access to the COVID-19 vaccine for those who are interested in receiving the vaccine. We are also really focused on our delivery system and really making sure that there's equity and sustainability with regards to the programs that are delivered by both our state-operated providers and our non-for-profits. So I'm really excited to hear from all of you about some of the key areas that you would like for OPWDD to focus on, clarify, and or provide some additional information on. So thank you.
Thank you, Deputy Commissioner. So our team leader for today is Kim Kaiser, who is a parent advisor from Families Together New York State and parent extraordinaire. So Kim, I'd like to introduce you and let you take it away.
Hello, everybody. I'm very, very happy to be here. Paige, I know you don't want me to say anything additional about myself. Was that my introduction? Because I hope so. I'm really eager to get this underway because all of you have such great questions and such dedication to this subject matter that I'm very eager to have the Deputy Commissioner here. All of your concerns. Now, what I would like to do is have each of you just quickly introduce yourself before we start. And I want to start with Sharon.
Okay, how you doing?
There you go.
Good morning. My name is Sharon Johnson.
Nice. And then who's next on my screen? Kathy Richburg.
Hi, I'm Kathy Richburg. I'm a current youth peer advisor for New York Fallon. I'm a former youth advocate that used to work for Vibrant Emotional Health, but I transitioned to working for the new training center under New York Fallon that's under DOHMH. So basically what I do is I help youth advocates across New York City. Currently, we're only working with the FRCs, but it will be like everyone as a whole. But right now, it's a new program. So right now we're just working with the FRCs and helping creating trainings for them that is geared to the work that they do.
Great. And Dawn.
Hi, I'm Dawn Jennings. I'm from Family Peer Support Services of Chautauqua County. I am an FPA as well as the Director of Services here.
Terry.
Good morning. My name is Terry Johnson. I am the Program Director for ICL's Family Resource Center, Northern Brooklyn, Zone 7, serving children from the ages 0 to 24 with STD diagnoses, seriously emotionally disturbed or at risk of developing a mental illness. Thank you.
And Diana Mendez. Diana, you're muted.
Still muted.
My name is Diana Mendez, New York City Regional Parent Advisor, working for Families Together in New York City. Looking forward to this meeting. Thank you for attending, Commissioner. Looking forward to all of this.
Thanks,
Thank
Diana.
you. Thank you.
And again, coming back to me, Deputy Commissioner, I am not just a parent advisor, I am the parent of a 14-year-old on the spectrum. And my passion is advocacy for the comorbidities of autism, the mental health comorbidities, and the cross systems initiatives and the things that can be done, especially to elevate the BIPOC community. Without further ado, I want to get started with our first question, which is going to come from Terry Johnson.
Good morning, Commissioner. It is a pleasure to have you here. I'm so glad that you're here to kind of share with us some of our concerns regarding services with OPWDD. I'm a mom of a 30-year-old autistic individual and navigating the services between OPWDD and OMH services and serving the zones within my target areas in Brooklyn. Some of our parents are coming in with their children that are dual diagnosed. They may have autism and and a mental health diagnoses as well. And trying to navigate the services from both entities has been a struggle for some of our parents. And one of the things that, you know, I would love to see is both OPWDD and OMH to come together and provide services for the parent, instead of saying, yeah, he or she is diagnosed with this, but you know, we don't serve that population. You need to go over here. And then the parent is being tossed back and forth. I would love to see where instead of sending the parent back, let's see what we can do for the child, and both entities, OPWDD and OMH, working together on behalf of the said child.
Thank you, Terry. That's a perfect cross systems question.
Yes, absolutely. And Terry, thank you for raising that. I think certainly OPWDD and OMH recognize that there needs to be much more collaboration across both systems, and certainly really making sure that individuals and families are able to better navigate both systems when services are needed. We've been doing a significant amount of work across the state, really to address the needs of those who need supports from both of our delivery systems. I know that you highlighted specifically that you're from New York City, in particular, Brooklyn, but there's so much going around across the state that I really want to take an opportunity to highlight some of the cross collaboration programs that we've developed with OMH and some of our other sister agencies, really to be able to assist those who need a more dedicated program and focus in both delivery systems. I can certainly start off with the New York City area and then sort of provide a broad overview of some of the collaborative efforts that we've engaged in across the state. I'm not sure if folks are aware, but more recently, back in December, OPWDD announced the opening of a new specialty mental health extended treatment unit that we refer to as the ETU. The ETU sits on the grounds of the former Bernard Feinstein Developmental Center in Queens. The ETU supports adults over the age of 18 from the 5 boroughs of New York City who have intellectual and developmental disabilities, as well as a mental health diagnosis, who are ready to leave inpatient treatment. The new 12-bed unit is a step-down unit, and it's really a step-down unit to the Kings County inpatient psychiatric setting that was most recently developed. And again, that's been a collaborative program and effort with OMH, really to be able to serve the dually diagnosed population. And we're really excited about now having this new resource to folks in the New York City catchment area. So I wanted to highlight that, and certainly if folks need some additional information on the Kings County inpatient psychiatric hospital setting or the extended treatment unit, certainly provide some additional details. There are details on our website, and I can certainly push the link into Brad or Kim for further sharing with folks. Similarly, there are other collaborative programs across the state. Back in 2018, we worked with both OMH and the New York State Department of Education to open the Our Lady of Victory residential treatment facility, which serves as an intensive treatment program. It's located in the Buffalo area, and it's a short-term residential program with an educational component serving youth age 12 to 21, again, who are duly diagnosed with developmental disabilities and psychiatric illnesses. We are also in the works of developing an inpatient psychiatric unit with specialty care for treating individuals with coexisting mental health and intellectual disabilities, such as those who are on the autism spectrum in both Buffalo and Syracuse. The units will essentially have enhanced staffing. They will include board certified behavior analysts, speech and language services, occupational therapy, and be based in a behavioral model which can be taught and communicated at the next level of care. Because we think that's critically important. It's one thing to receive treatment and services from an inpatient unit, but it's important for those therapies and those services that have been provided to be able to communicate to the next level of care, whether that's in someone's home or in a residential facility that is not as intensive as the inpatient unit. So I just wanted to share that, and of course, if additional information is needed, we can provide that. But again, Terry, a critically important area that both OMH and OPWDD is equally invested in.
Thank you so much for sharing that and very informative and important information.
You're welcome.
Thank you so much, Terry. And thank you, Deputy Commissioner. I want to move on to our next ambassador's question, and that comes from Ms. Kathy Richburg. Kathy, can you unmute, please?
Hi, so I'm so happy that you're here so I can ask these questions, because it's always been one of my concerns when I was a youth peer advocate, working for the mental health system and things like that. So you kind of pretty much answered it, but I'm speaking in a youth term. So as far as OPWDD cross systems, I feel like I would love to see a collaboration of trainings for youth peer advocates who work with dual diagnosed youth, because that has been becoming very common in the workforce of you receiving a referral, or you receiving a youth that just walks in, and sometimes as a youth peer advocate, you don't really know what to do. You don't. And there's no training involved in teaching youth how to deal with maybe an autistic kid that has a meltdown in the youth group, or maybe they have social cues that you didn't catch on to and you triggered them in the youth group. It's a lot of different factors, and my number one goal is to have it that we have a collaboration where I'm able to support youth peer advocates and provide trainings for them so they're able to know how to deal with dual diagnosed youth directly. So how would you guys, pretty much go about helping when it comes to youth peer advocates in that aspect?
So Kathy, another great question. And again, I think it sort of dovetails off of the comments that I provided previously, and certainly our interest in creating a continuum of care for folks who are dually diagnosed. I'm not sure if folks are aware of our CSIDD program. CSIDD stands for Crisis Services for Individuals with Intellectual and Developmental Disabilities. It's a rehabilitative, short-term targeted service for individuals with IDD who have significant behavioral or mental health needs. CSIDD provides training for staff in order to support folks who are dually diagnosed. This is an upcoming focus of collaborative work with OMH to really strengthen the training to staff supporting individuals who are dually diagnosed, and really having an understanding of how to navigate the two systems of care to bring the person-centered planning together. So we think it's a critical area of focus, and our CSIDD program really highlights and provides those key components that staff need and require in terms of supporting individuals with complex needs. We have additional information on our website, but again, I can certainly push in some links and material to folks. And as we move forward in terms of developing the training, we'll certainly be sending out information more broadly so that folks have access to that information.
Thank you, because right now, me working for the training center, I feel like it's important for me to have that information so I'm able to provide trainings to my youth peer advocates, because that is, and it has been a big concern. I've been a youth peer advocate I used to work for actually not Families Together directly, but I used to work for Families on the Move. And when I was a youth peer advocate as an intern, that was my number one concern. having so many youth that were dual diagnosis and being like, I don't know what to do. Also, I feel like I'm an advocate for this because I have a son that's on the spectrum myself. So it's kind of like something that I'm geared to really helping youth peer advocates understand them, because a lot of times you do get that youth that has autism. It's like, no, I noticed it's just more common than ever. Like working at Family Resource Center, I was like, okay, I would get youth that were dual diagnosed, and it was always, oh, they're on the spectrum or they have Asperger's, you know? So it would be me not understanding them and then triggering them, you know? And now that I have my own son, I'm like, I think it's important for us to have a big collaboration, no matter if you're under the contract or not. You just, you know, have the trainings that the directors know directly about, so they can have the youth advocates receive it, because youth advocates is the ones that work directly with the youth. At the end of the day, the family advocate can help, but the youth works directly with them.
It's very
so it's
true. Very true, Kathy. And Deputy Commissioner, you have Kathy is an amazing advocate. She's doing an amazing job at spreading the word, training staff, and elevating the voices of the dually diagnosed community. And she's a parent, so she's kind of like she's a quadruple threat. So thank you so much, Kathy.
No problem.
I want to move on a bit off script now, because Joseph Damiano has entered the room, and Joseph was one of our first ambassadors that had a question. Joseph, I'd like for you to introduce yourself, who you are, and lived experience, profession, and then ask your question. All right?
Okay. So hi, my name is Joseph Damiano. I am a peer support specialist at the ARC of Allegheny Stu Bend, and I'm also a person with an intellectual disability. My question is, where do you guys see the future of services, specifically with respite services?
So Joseph, it's a pleasure to meet you. And I think, again, great question, because as I noted in my introduction, we're really focused on equity and sustainability, and really making sure that we preserve the critical supports within our delivery system to be able to meet the needs of individuals. And I'm not sure if folks were in tune to some of the budget briefings that we provided, and certainly that our commissioner testified to, but as proposed, the budget does not currently identify any reductions to respite services in particular. Obviously, we can talk more broadly about the delivery service, but since you asked about respite, I wanted to respond to that directly. However, it's really critically important that individuals, families, key stakeholders continue to advocate to really ensure that the federal government provides New York State with at least, $15 billion in aid to address the financial and economic impacts of COVID-19 that COVID-19 has had on the state, which will better position the state to avoid the need to take any additional cuts. We've tried to be extremely strategic in not cutting any of the services in our delivery system, the direct provision to services. However, if we don't receive the additional aid that's needed, we will be asked to reduce spending each year by around $26 million, including services supported by Medicaid and non-Medicaid. And I highlight that because it's critically important that folks continue to advocate so that we can receive the appropriate aid that's needed, really to ensure that our delivery system remains intact. So I'm not sure if I responded to all of your questions, but again, there are no proposed cuts to respite specifically.
Thank you, Deputy Commissioner. And thank you, Joseph. I do want to now move on to Sharon Johnson.
Good morning. I'm a parent of a son, 33 years old, who has a multiple diagnosis. He was originally diagnosed with autism as a young child, And then in his 20s, he was also diagnosed with bipolar. So he also has dual diagnoses. He's lived in a group home for 13 years in a nonprofit vendor group home. And I would like to know what OPWDD is going to be doing to increase the wages of the direct support professionals who are essential workers, both pre and during the pandemic, and who provide 24/7 care for individuals such as my son, both in residential and day habilitation programs. It is my experience that these essential workers, the direct support professionals, need ongoing professional training and a professional wage, not something just hovering around minimum wage, because they are professionals and they deserve that treatment and pay. Thank you.
Sharon, thank you so much for sharing your thoughts on this topic. I mean, we all know and recognize that the direct support professionals are the lifeline to our delivery system, and certainly to the individuals and families that they support. As a point of reference, OPWDD alone has made over $650 million, all shares, so that would be state and federal, available to providers to fund the minimum wage increases and enhance wages and benefits of our direct support professionals and our clinical staff, really since 2015. The fiscal year 2022 budget provides the equivalent of another 58 million, all shares, relating to supporting providers to comply with the state's minimum wage law, bringing the total all shares resources to over $710 million in terms of investment. So I highlight that again to show that we absolutely recognize how critical it is to make sure that we have a viable workforce that can continue to provide the required supports to the staff who support the individuals in this delivery system. But I want to note that while wages are absolutely important, I think that there's another area that's equally as important, and you spoke a little bit about that. For us, it's not only just about wages, but certainly retention and recruitment. And we've really focused on this area with our workforce talent and management division. We have staff dedicated to retention and recruitment efforts really across the state, working with our voluntary providers, but also working with our regional centers for workforce transformation. The regional centers are funded by OPWDD. They offer free training, workshops to support recruitment and retention. We've also been working with our BOCES, conducting a pilot in the Capital Region on high school and adult direct support programs that we hope that we can replicate throughout the state. It started this past fall. We're also continuing our partnerships with SUNY to explore direct support training programs. And then more recently, working with the Veterans Department on recruitment efforts. We have established a field program that allows veterans who become direct support professionals to receive a financial incentive from the federal government. And we also partnering with the Department of Labor on DOL job fairs, providing key information to those who seek to become a part of the delivery system. I think long term, We're finalizing frontline supervisor competencies that will assist the field in training and retaining supervisors. And we hope to have this be a mandatory part of the curriculum moving forward.
Well, thank you. I'm very interested in your pilot programs, and I think that's terrific. I'd also like to ask you about the cost of living allowance, which has not been instituted in over 10 years.
Absolutely. I mean, we recognize that. I think that, you know, we really try to focus our investments on the wages that I just mentioned, and really trying to make sure that we can sort of bring the state and the folks who work within the delivery system, you know, up to a livable wage while we continue to review and explore further investments. So, you know, obviously it's on, you know, the forefront of, you know, our planning and certainly dialogue with others in terms of sustaining the delivery system. You're right that there haven't been specific increases in a number of years, but we've really focused the resources on the wage increases that I just outlined for folks.
Thank you.
Sure.
Thank you, Sharon. Now I want to move on to Dawn Jennings. Dawn, can you unmute?
Commissioner, thank you for being here today. I really do appreciate it. I introduced myself before as a Director of Services for Family Peer Support, but I also want you to know that I am a single mom of 2 children with diverse disabilities. One's on the spectrum. I have one who's also OMH and physical disabilities as well. And one question that I had for you today is, with my personal and my professional experience, I would like to know what supports will there be made for the siblings of the children with the diagnoses. And this has also been brought up by some of our clientele in the district as well. So I not only bring this from a personal perspective, I also bring it from professional perspective in the community.
Dawn, thank you for that question. I previously mentioned in response to Kathy's question, our CSIDD program, our Crisis Services for Individuals with Developmental Disabilities. I think that the benefits of this program are tremendous. It not only focuses on the individual specifically, but it also focuses on the system of support for the individual. Providing training not only for staff, but certainly for family members who are tasked with engaging and supporting the individual, and really looking at some of the critical services to be able to assist the unit to better support the individual. Also recognizing that there are at times specific needs that, you know, a sibling or a family member may have because they are supporting an individual with intellectual disabilities. And I just want to highlight our family education and training program. It's a waiver service and provides training and education on key topics such as sibling issues. It looks at socialization and recreation options, accessing mental health care. There are so many robust topic areas that our family education and training program provides, and certainly I would highlight that and CSIDD as a key resource for families and siblings who are supporting an individual with intellectual and developmental disabilities.
Thank you, Commissioner. I appreciate that.
Sure. And Dawn, if you're seeking, you know, any additional information on those programs, you know, as I highlighted before, we can certainly share specific information. I believe that you noted that you were from, I think, our Western region.
Yes.
And so we have a regional office in both Western New York and Finger Lakes that can provide additional information on each of these, on each of the services that I outlined.
Thank you. I would appreciate that.
Great.
Thanks a lot. I also want to speak to an attendee here who was to be a panelist, an ambassador rather, and his name is Xavier Skeeter, and Xavier is a self-advocate. And Xavier wants to know what OPWDD is going to do to support more recreational activities and other social supports within the community.
So again, I think all critical components of the delivery system, you know, when Joseph asked the question about respite, you know, I had highlighted that there are no intended cuts to respite. And in fact, we've really been able to increase respite over the past 5 years by 22%. And that was specifically because we recognize that respite not only provides relief to caregivers, but also provides opportunities for individuals to engage in recreation, socialization, and really be able to become a part of their communities by involving themselves in some of the key activities that our respite services provide. We've also, you know, respite is also provided through the family support contracts that are made available to individuals and families across the state. And we see that as, you know, an equally important service for folks. So as I noted at this particular point, there are no intentions to cut those services, and we've actually been able to grow those services. And certainly, you know, we hope to be able to do that moving forward as well.
Thank you so much. And we do have a question from a dad. His son is in need of a new apartment. The prices are too high, so he wants to know when will families see an increase in housing availability and lower costs, so that individuals like his son are not living in substandard housing within communities that are not as safe as any parent would like to see for their child's living environment.
Great question. Housing is such a critical service and support for individuals. And we've certainly heard from a number of stakeholders that there needs to be sort of more education options and opportunity around housing. Our proposed budget really takes a specific look at the housing options within our delivery system and really trying to make sure that folks really understand that there's a continuum of options for individuals to be able to pursue, again, based on their level of need. We've also been working with, you know, our partners at HCR to really increase supportive housing for folks. We have our integrated supporting housing initiative that makes available affordable housing to individuals across the state. And really will continue to sort of highlight the strengths of that program to make sure that affordable housing remains available for folks. We're also looking at our delivery system and looking at how we manage the housing option, again, to really make sure that, you know, individuals that require a specific level of care in terms of housing are able to receive those services. So there's a lot of work being done on housing, and I'm certainly excited about being able to share some of those updates as we move forward throughout the course of the next year and really strengthening those supports for the individuals within our delivery system.
That is wonderful. And one last question, if time allows, Miss Melody Hecker. Melody Hecker, and she's speaking to something that I am particularly passionate about, was when you have a child with disabilities, with a dual diagnosis, how can OPWDD ensure that young people with disabilities or with a dual diagnosis receive the necessary support for successful transition into adulthood? And speaking to this and adding to Melanie's very important question is the simple fact that we know transition should begin best practice in middle school. Lots of jurisdictions, it begins in high school, 9th grade, 10th grade. The transition to services feel like a mad scramble, and children who could be geared towards a collegiate career are geared towards more of a day hab oriented career. Their skills are not elevated, their talents and their passions are not valued. the whole perspective and the awesome goal of OPWDD to engage in self-directed services gets lost in the other systems. You know, solidly self-direction works. It's a great model. However, how does that work when you have a transitional team that is just going by the numbers and not by the individual, and defining and preparing them for doing what they want to do and what feeds their skills and talents?
So again, another great question, and you know, we've been doing a considerable amount of work with SED on this issue, transition planning, and really making sure that individuals and families are aware of the services and supports offered by a delivery system. We have OPWDD. We have regional offices across the state, as many of you already know. Within our regional office structure, we have local school transition coordinators who really serve a critical role in providing key information to local school districts about the services within our delivery system as early as possible, so that individuals and families can be engaged and reach out to our front door, which is the initial point of contact, and begin those discussions, so that when individuals are ready to transition, they're already familiar with the delivery system, eligibility has been established, and we can really sort of build upon that and offer services that align more appropriately with the individual's needs and interests. Over the past several years, we've worked specifically to grow our employment services and really be able to provide individuals with a plethora of options and opportunities, not just, you know, sort of focus folks on some of the more traditional models that some may not be interested in. Certainly there's more work to come in that area, but I think it's critically important for individuals and families to reach out to our regional offices as soon as possible. We have done fairs at local school districts. We've pushed out information and pamphlets. There's some really good information, again, on our website, but I certainly recognize that there may be a need to do some more sort of local boots on the ground information sharing to make sure that folks understand the options and the services that are available to folks. So, you know, with the feedback that we receive from stakeholders, we continuously work to improve in that area. But I'll certainly take this back to our partners at the State Education Department and have some more dialogue and conversations about how we can better improve in this key area.
Thank you so much. And we are just about at the 10:45 mark. And I would like to kick it back to Brad and Paige.
Thank you. Just a quick note, Deputy Commissioner, we're getting a lot of people that are requesting that you share some of the information that you spoke to today, some of the programming and training. And in terms of helping the agency get the word out about some of these things, you know, we have a large field of families and young people that are eager to give resources when they can find them. So any information that you can share with us, we can help you get that word out and be partners in that engagement.
Sure. Brad, can I send the links to the programs to you and then
yes.
have that? Okay, we will make sure that we get that to you.